A school-based vaccination clinic model developed by medical students from UCC, presented by Pérez Verdejo, and co-authors and co-presenters Myrmarie, Cruz, Pérez, and Myrmarie. In 2020, the World Health Organization declared a pandemic state for the virus named Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2, commonly known as coronavirus or COVID-19, referring to the disease's causes. By December 2020, the Puerto Rico's Health Department reported 71,650 confirmed cases of COVID-19, with over 1,500 confirmed deaths. Around this date, emergency use authorization of COVID-19 was approved by the Food and Drug Administration, FDA. The Centers for Disease Control and Prevention and Puerto Rico's Health Department established guidelines and requirements for the planification of school-based vaccination clinics. On December 11, 2020, the faculty members and leaders of the student body of UCC got together virtually to work on developing a school-based vaccination clinic. In this report, we describe step-by-step the process developed and the impact made through a year clinic. Committees were developed to address each aspect of the clinic, from information system to data entry. Before each clinic, student leaders from the different committees met to discuss how the vaccination day will proceed. Information systems, led by Manuel Colón, informed the appointments for the day and the kind of population that will be receiving, so education and pharmacy committees can be prepared in their respective tasks for those people. Education, led by Myrmarie Cruz Pérez, developed didactic material, which included hard copy information and audiovisuals to help participants on their vaccination day and clarify any doubt. Pharmacy, led by Pérez Verdejo, assessed and separated the vials for each clinic to guarantee that all participants who had an appointment will receive their shot. These three committees communicated with volunteers leader Myrmarie, who recruited and organized the necessary volunteers for the day. The volunteers were distributed depending on the necessity of each area of the clinic. Modification during clinic day would be made. This process allowed the vaccination clinic day to run smoothly, while participants had a good experience during their visit. Here on Figure 2, we show the overall layout for ambulant participants of the vaccination center from December 2020 to May 2021. The appointments allowed the vaccination clinic to comply with CDC and Puerto Rico's Health Department guidelines of social distancing and mask wearing all the time, while avoiding bottlenecks, resulting in clusters of participants. When participants arrived, they were welcomed and received by volunteers of the Education Committee. In this first step, any doubt is clarified and education was provided about the vaccine that they will be receiving, while also verifying that all documents were filled correctly. Afterwards, participants went to ID check and registration, where their appointment was confirmed and informed consent was acquired. Participants received a card that they will have to complete with the following steps. After informed consent was received, participants went to the immunization area, where the vaccine was administered by physicians, medical students, or nurses. These volunteers had to be certified for COVID-19 vaccine administration for adults and pediatrics. Participants were oriented about possible secondary effects and how to address them. When immunization was complete, distribution of participants was made depending on whether they were high-risk or general population. High-risk population was mainly immunocompromised or with a history of asthma, COPD, or allergic reactions to other vaccines, and they would have to complete 30 minutes of observation. General population was observed for 15 minutes, and after completing the time, they were able to exit the center and hand off the card with the steps for field. On Figure 3, we show how the previous layout for ambulant participants was adapted to drive-thru. It was implemented to accommodate participants that have difficulty walking or standing for long periods of time. The different area was the waiting area. There, they received education and informed consent before continuing to the immunization area. Observation was also addressed with 15 minutes for the general population and 30 minutes for high-risk population. High-risk participants were previously identified on registration, marking their card with the corresponding sticker on the front window. This vaccination clinic model allowed the immunization of approximately 20,511 adults and 86 pediatrics as of February 2022 with the Pfizer-BioNTech COVID-19 vaccine. Also led the way for the development of 16 research projects by second-year medical students led by Humberto Nieves Jimenez. The clinic contributed to the development of a vaccination elective course for fourth-year medical students. Finally, promoted the development of a volunteer summer program for undergraduates pursuing a medical career. The clinical layout and logistic plan developed from the welcoming of the participants to the vaccination table and observation area proved to be an efficient plan for a school-based vaccination clinic. This model showed high efficacy for administering around 600 doses in 4 or 5 hours, while complying with all CDC and Puerto Rico's Health Department regulations implemented for COVID-19 pandemic. Proactive communication within committee, trained volunteers, reunions after clinics to seek areas of improvement. The clinic layout, the online sign-ups, and the incorporation of undergrad students into the volunteers were essential components that help us achieve the purpose of the clinic. While the clinic design was effective, improvement can be made in the recruitment of pediatrics participants. For future works, it is important to engage with this community, focusing on the education about the vaccine and how the pros outweigh the cons. These are our references. For the acknowledgements, we would like to thank Dr. Eric Gonzalez and Dr. Juan Salgado for all their support, Lilian Rivera for her assistance, and Dinelli Pérez for her role in vaccine storage and cold chain. Doctors Valeria Lozada, Kenneth Aviles, and Gabriel Colon for their support in the development of this project, also our colleague Adriana Termos. Finally, all the volunteers and undergraduate students that collaborated during the clinics.